Hi everybody, I'm Kimberly. And one thing I like to work with my clients is try to find a way to keep track of their labs and their ultrasounds or MRIs. I work with a lot of people that see a lot of doctors, or even if you're one of those people who just has your annual exam and you have those annual labs done, and you kind of wonder, how is my hemoglobin or how is my cholesterol doing? You might not remember. So I tell people that work with me, and I encourage you as well, to get a 3-ring binder. At the time when school's going back into session, you can find these really cheaply. This is just a 1-inch binder that allows you to mark something on the side. You can peel this off, slip a piece of paper in here that just says like Kimberly's healthcare labs or healthcare assessments. And I try to keep everything related to my healthcare in a 3-ring binder. I recommend that you grab tabs. So these, sometimes you can use multicolored tabs, or this is just a plain white tab that allows you to write on these. So you can put like one tab would be labs, MRIs, CT scans, ultrasounds, x-rays for chest x-rays. And this can become a lifetime binder that you can keep that will help you evaluate and maintain and assess your own healthcare as the years go on. Because a lot of times when I'm working with a client, I'll say, oh, did you have an ultrasound? They'll say, yeah, I had an ultrasound like 2 years ago, maybe for a kidney stone or for a gallstone. And I'll say, well, what did it tell you? And they say, well, I know there was a stone, maybe a few, but I don't know the size of them. The beauty of having the tabs is that you would put that behind the ultrasound tab. And then I encourage people to highlight those areas so that you can maintain and manage those and monitor them. A lot of times when you're meeting with doctors or even doing your annual physicals and you want to keep track of year to year how you're doing, when you have all your labs under one tab, you can have like 2018, 2019, 2020, and you put the oldest in the back and the newest in the front behind that tab. But at least you have this ongoing running analysis of your labs, and you can look at them year by year. And that way, if you happen to go to a new medical doctor or a new even natural healthcare practitioner, you can bring that with you and have a conversation with them about what your labs were and what they are currently. And a lot of times we can see things heading south way before they actually head south, like maybe a hemoglobin going down and somebody becoming immunocompromised with a white blood cell count, or watching a liver. So again, I recommend getting a 3-ring binder, getting some tabs. It doesn't matter what you get. If you get the colored tabs, even if you don't love to spend very much money, or you're not even a tab person who loves to do tabs, one thing that I do is I can buy these little stickies, little post-it stickies. These are 1-inch. They come also in a 2-inch and a 3-inch, depending upon what you like. I love colors because it brings my eye to different things. Like I put red for blood. I'll put green for digestion. It can be a lot of different things you can do. But you just stick it on the edge of the labs, and then you just write on it right here on the tab. You can say labs. So that way you don't have to even buy the dividers if you don't want to. But this is a really slick, easy way to keep track of your healthcare personally, because when you go visit lots of different doctors over your lifetime, they're not going to have your full health history. You should be your best healthcare practitioner and an expert on you. So being able to keep things behind this, behind the tabs and in the binder helps keep everything organized. So every time you go to a doctor and say you have some labs drawn, make sure you get into your MyChart, download those labs, print them off, and put them in here so that you have all of them up to date, because otherwise years go by. If you happen to have a little bit of time off and you've never done this before, take the time to download those things and put them into here. And if you have questions, talk to your doctor. They'll be a lot of times very willing to answer questions for you. You can email the nurse that works with them and ask them questions. Otherwise, if you work with a natural health practitioner, they can also help you decipher what your labs mean, or ultrasounds as well. So hope this is helpful. I think this is a great way to help maintain your health care and for you to be aware of how you're doing on an annual basis with your health. Thanks for watching.